Hi, my name is Debbie Close, and I'm here to talk to you about ADHD. Being told that your child has ADHD can be very daunting, and it can give them a label that they will carry for the rest of their lives. ADHD is the most diagnosed psychiatric disorder in children. 3 to 5% of children globally are diagnosed with this disorder, and 2 to 4 times more boys are diagnosed with ADHD than girls. I'd like to introduce to you my son, Philip. When he was in the 3rd grade, he was diagnosed with ADHD. But his teachers, from the time he started kindergarten, were trying so hard to get us to have him tested because they said he was hyperactive. We took him to his pediatrician, who was a very kind, elderly gentleman, and he just kept reassuring us that Philip was not ADHD. He was just busy. He was a busy little boy, and he was very social. He was a very social little boy at school. He liked to take new students around and introduce them to everybody and show them where the bathrooms were and the cafeteria and the playground, and he was just active. But finally we listened to teachers and had him tested, and it was confirmed that he was ADHD. It was really difficult attending parent-teacher conferences all of those years because we never heard positive comments about Philip. It was always the negative things that he was doing in class, the disruptions, the talking incessantly, the not being able to keep his hands to himself, the very symptoms of ADHD. There are varied treatments for ADHD, and we did quite a bit of research into it, and we opted to go with medication. We felt that route because of his age. We didn't feel that he was quite old enough yet to be able to articulate just exactly how he was feeling, so that we didn't feel that therapy was kind of the route to go. But as he entered his teenage years and really kind of got into different behaviors, then we did go into some family counseling, and he did some individual counseling. And it really started to work once he acknowledged that he needed to participate in his own therapy. Some of the symptoms of ADHD, again, are not being able to pay attention, a very small attention span. Philip's problem was he couldn't keep his hands to himself. He was always reaching out and grabbing people. He couldn't stand still in a line. If they had to line up to go out to the playground or to go to lunch, he could not stand still. If he had to sit in his chair at his desk, and being seated was the task, he could not do that. He was up and about and running around the classroom. And ADHD is really very difficult to diagnose because there are so many different symptoms, and each child is almost different because of the things that they exhibit. The American Academy of Child Adolescent Psychiatry, they follow a stricter guidelines before they label children as ADHD, because they're aware that it does kind of lend a stigma to the child that they're handicapped or that they're different. And when you're a small child in elementary school, that's the last thing you want to do, is be different. So some of the behaviors that I've been talking about, they feel that they must appear before they're at the age of 7, and they have to continue for at least 6 months. And they have to be in 2 different areas of the child's life. For instance, in the classroom, on the playground, at home, in their community, or in social settings. Along with ADHD, there can be other disorders that can be exhibited. For instance, bipolar disorder, anxiety, depression, or OCD, obsessive compulsive disorder. I have spoken a little bit about treatments. There, of course, is medications, and now there are some that are not stimulants, so they're not narcotics, so they're supposed to be better. And of course, therapy where the child can learn different behavior modifications, and also diet. The last thing I want to bring about is that schools don't really know how to handle children with ADHD. They have above average intelligence, but yet 37% do not even get a high school diploma, and half of them don't even finish high school, and less than 5% get a college degree. So I am very proud of my son Philip, because he is part of the class of 2011 from Curtis High School in University Place, Washington. He beat the odds. He has stopped his medication because he is going in the Army, and that was part of the requirements, is that he had to be off of his medication for a year prior to enlisting, and that has happened, and he is doing very well. So I'm very pleased and very proud of him. Educating yourself about ADHD is the key, and you just need to treat your child as if they are not handicapped, and they can be a success. Thank you for listening, and I hope you have learned something. Thank you.